Thanks for listening to Season 1, Episode 1 of the new Family Matters Show podcast. I'm your host, Benjamin Bryant from Bryant, McKinnon Lawyers, and I'm here with my partner, Heather McKinnon. Hi, Heather.
Hi, Ben.
I'm very excited to be kicking off this new podcast.
Yeah, as you know, we're passionate about trying to get information out to the community, free of charge, that's of good quality, to get rid of the myths about family law. And we think this format's going to really help us reach a better audience in a better way.
For those of you that don't know Heather and myself, we're both accredited family law specialists here at Bryant McKinnon Lawyers in Coffs Harbour, and we see firsthand how difficult and scary separation can be, and that's why we started this show, to get some questions answered without getting lawyers involved, and so to help people navigate what can be a very difficult and complex system in a difficult and complex time. Today we're going to tackle one of the biggest concerns for many people going through a separation, and that of course is the parenting arrangements. What is going to happen with the children? Too often children are unintended collateral damage during a divorce, and so for this show we're going to focus on how we can help children cope through separation. And to help us deal with this subject, of course, we're joined with Dr. Ian Nisbet. Hi, Ian.
Hi, Ben. It's good to be here.
Thank you for joining us. For those of you that don't know, Dr. Ian Nisbet is a forensic psychologist based in Coffs Harbour, current practicing as a private psychologist with the Australian Psychology and Wellness Centre. He works with children, teens and parents to assist with relationship and conduct problems. He also works extensively in the court system, providing family reports and forensic psychological reports. He has previously worked as a lecturer at Griffith University and with New South Wales Juvenile Justice. So Ian, this is an incredibly large topic, and every family is different, of course, and so with children, different ages, personality, maturity types, the nature of the relationship between the children and the parents are different, but in that context, we're going to ask a few questions anyway in this short program, and we're going to ask some pointed questions that Heather and I ask frequently in our interview rooms. And again, thank you for being with us today.
Yeah.
And so Ian, given that every situation is different, what would you say are the 3 or 4 most important things for parents to keep in mind if they want to minimise their children's trauma from separation?
Look, I think the best outcomes for children in these kind of matters is when the parents are able to somehow amicably arrange the living arrangements for the children in a way that doesn't involve a lot of hostility and anger directed towards the other party. Children are very sensitive to how their parents feel about, how their parents feel in general, but also how they feel about the other party as well. And as much as possible, if parents are able to shield their children from the conflict, that's what leads to the best outcomes for children.
And Ian, I know you were just talking in about kids are very in tune with parents, and often when we see people, they think that it's just what they say. But I think that in your role you would say kids tune into a lot more subtle things than the words coming out of their parents' mouths.
Well, that's right, and not just children. I mean, we know that about human communication in general. That in fact, it's more the tone of voice, the body language, and so forth, rather than the actual words that people use that conveys meaning. But yes, certainly children are very sensitive to their parents' moods and to whether the parents are happy or sad and what things might be troubling them. And we know also that unfortunately sometimes, because their children and their experience of the world is very small and short, they make sometimes wrong assumptions about things. And I think we're probably familiar with the scenario where sometimes children will think that the reason mummy and daddy are angry and are separating is because they've been naughty or something like that. So sometimes children misattribute things as well. So it's a very difficult time for children. And I guess here I'm speaking obviously mainly about younger children, but there's obviously people involved in family court matters go from having quite young children right up to teenagers as well. So it's a little bit different depending on the developmental stage children are at.
I know some of the things that your profession's taught us over the years is with really little ones, they will smell stress, and you can try and be calm, but if as a parent you've got really anxious things happening inside, the kids will be very attuned to the smell that's on the skin even.
Yeah. And of course that's very difficult not to be anxious and stressed when you're going through this kind of situation as well. So it's a very difficult time for parents also.
And is there any other practical steps you can think of, Ian, or common practical steps that parents could take to help them shield their children from the conflict and trauma?
I guess I'd probably think more in terms of good things for parents to avoid, and so as much as possible avoiding the children being collateral damage or being caught in the middle. So not denigrating the other parent in front of them, but also not asking the other child to be some sort of go-between in terms of ferrying messages to and fro, or even spying on the other parent, or trying to use the child to get some kind of information about what's going on in the other household and things like that. Those things are really best avoided. Trying to avoid, like I said, denigrating the parent, or possibly sort of blaming the parent, the other party for things, and making sure the child knows that the reason that something has happened or hasn't happened is because mummy or daddy wouldn't let it happen or something like that. So dragging the children into the conflict is not in anyone's best interest, and particularly not the children's.
What happens then when little ones take on those responsibilities and feel that they're somehow going to control outcomes? What, as a psychologist, can you predict about what will happen to little ones that become over-involved?
Well, obviously it greatly adds to their stress. It makes them anxious. It can lead to a whole lot of other kind of outcomes in terms of them not doing so well at school, or not being able to sleep can lead to somatic kind of problems as well. So overstressed children are likely to suffer a number of both general physical health, but also mental health poor outcomes.
And I find with older children, especially, Ian, parents sometimes forget how their children can receive information. Sometimes people think it's because they're on the telephone and they can hear the other parent, or conflict or changeovers, but sometimes it can be something like Facebook. Facebook is a great opportunity for us to communicate with our viewers live right now, but it can also cause some serious damage.
Absolutely,
I know parents, especially with younger children, their primary means of communication is Facebook, and they can actually see their friends with their parents, or their friends of friends, and they can see their posts. So I'm finding that's a big problem.
Yeah, absolutely. I mean, Facebook, like you say, it's a tool. Basically, we're using it as a tool today, but like most tools, a very sharp knife. Very sharp knives are very useful tools in some situations, and also very dangerous in the wrong hands as well. So absolutely need to be careful about that.
And Ian, one of the things I know parents agonise about is how to break the news of their separation to their children. Does it make a big difference how this is done? And do you have specific recommendations how to best do this?
It depends very much on the developmental stage of the child. And so, particularly with teenagers, the chances are that it will come as no surprise to the teenagers if parents are going to separate, because they can generally kind of see what's happening and pick up the vibe and know what's going on. For younger children, I think the most important thing is for the child to know, if we're talking primary age or below, for the children to know that they're not to blame. It's not because they've done something wrong, or they weren't good enough, or they weren't well behaved enough, or whatever, but that it's just that sometimes mums and dads don't get along, and that that they still love the child very much, that as much as possible things are going to continue as normal, but they'll be doing it probably from some separate houses in the future, so they won't necessarily be living together. But I guess it's important for the child to know that what has been their world up until now can actually continue, and that they can still have a secure relationship with both parties, like the mum and the dad, but it may be under slightly different circumstances. But I guess for the younger children, they need reassurance that it's not the end of the world, that things are not going to change into something awful and different, but they will still be able to be with both parents.
And how do you help a client who, at the time of the relationship breakdown, is feeling completely out of control, to give them immediate assistance so they don't involve the children? What sort of practical assistance would you give a client in therapy to help them set aside their needs from those of the kids?
Yeah, well, that's quite difficult. I've spoken to parents. Sometimes they come and see me because they just received the news that their marriage is over, and that totally, for some people, comes as a complete shock. And so trying to work out what to do. I think something that helps is to get, what I try to do is provide them with some information about things that may happen from now on, and also to encourage them to get some advice and for them to develop some kind of understanding about what might happen. I guess I think for some parents that experience is like trying to cross a room that's got a whole lot of furniture and suddenly the lights have gone out or something like that. Like they don't know where the obstacles and the dangers are and everything. But if you try and shed some kind of light there, and they can at least understand, well, these are the things that might happen. These are the things to watch out for, and for them to feel like they have some level of control. So maybe there are some little things that they might be able to have some control over in a situation where they feel that things are very much out of control, and also just general mental health things as well in terms of when they're dealing with a big shock like that, to make sure that they moderate use of alcohol, be careful not to drink too much, make sure that they're actually still eating regular exercise, diet, things like that. That helps. Those kinds of things are helpful for your general mental health in any situation, but particularly when you're facing a very stressful situation like the end of a relationship.
And when would you indicate to a person that they would benefit from going to their general practitioner to get a referral to a psychologist? A lot of people who see Ben and I, when we say, look, we think you'd get some help and benefit, are resistant because of the old stigma that we have. So can you give an overview as to what the Medicare system now does in terms of getting access to psychologists and why it may be a strength, not a weakness?
Yeah. Okay, well, I'll give you an overview of the Medicare system, which is currently under review as well. But look, at the moment, under what's called the Medicare, the Better Access Scheme of Medicare, Australians are entitled to 10 rebatable sessions with a psychologist per calendar year. In order to get that rebate, you need to get a mental health care plan. So the first thing is that you would need to go and see a general practitioner, advise them that you want to come in and have an interview for a mental health care plan, because that actually takes a little bit longer than a standard consultation. And then in that, the GP will create a referral to a psychologist. It doesn't have to be a specific psychologist, but generally GPs will have they will know which type of psychologist would probably best suit the situation. It's important though that the GP is able to put the specific mental health diagnosis that they want the person to be treated for. So for example, you can't, if it's prior to separation or something, the GP can't actually write a referral, say, for marriage counselling. Marriage counselling is not actually a mental health issue that's covered by Medicare. But what often happens is, particularly when the relationship ends, someone will just be finding it very difficult to adjust to the new situation, and so there's actually a diagnosis called adjustment disorder, which is very often the diagnosis that people come with on a mental health care plan. So as I say, once you've got your mental health care plan, you can then call a psychologist and make a booking. And it doesn't have to be specifically the psychologist that the doctor recommended. You can go to any registered psychologist, or a psychologist that's registered with Medicare, which is most people in private practice. And that's the process. Depending on the psychologist, it could be a gap between what the psychologist charges and what Medicare will cover. So that gap could be anything up to maybe $100, depending on the psychologist. What the psychologist charges and the particular part of Australia you might be living in. So in different areas it costs differently. Some psychologists will bulk bill people that may be on a healthcare card or may have limited income. So if it's bulk billed, there's no gap. But they're the sort of stages to go through in terms of the practical stuff. Now, I think it's a good idea to get some support, because particularly, I guess, the great benefit of seeing a psychologist is that you can go and you can totally unload and just blurt out all the stuff, and there's no expectation the psychologist has to be there for you. So some people, they will often lean on their friends and everything, but they may be reluctant to tell friends too much, because there is that expectation of friendship that's a two-way thing. You don't have to worry about the psychologist, because that's what they're there for. So you can just you have to, take a particular interest in them. Psychologists as they're interested in you and how you're coping with things.
Yeah.
So, the best psychologist will give you 50 minutes of quite focused attention and hopefully empathetic listening and so forth, which is again generally beneficial for everyone.
Mm-hmm.
I guess the thing that sometimes people may be concerned about in terms of seeing a psychologist and if they're involved in family court litigation, is the possibility that the psychologist's notes could be subpoenaed.
Yeah.
Yes.
And I think the psychologists are aware of that. I guess if you're going to engage a psychologist, you should be aware that that's a possibility as well. So, that's the nature of...
But I think one of the things that we would say is that if you're assessing a family and somebody did get assistance for that adjustment problem, it's likely to be seen as a benefit because they're aware they need help to minimise the damage to the kids.
Yeah, you would certainly hope that's the case.
Yeah.
And just taking up on that, Ian, we were talking about adjustments, of course, in the parents, but of course there's adjustment of the children as well, and the children have to grieve the loss, of live with parent or perhaps the breakup of their family, and some children take longer than others. What can parents be on the lookout for, which might indicate that their children are perhaps adjusting or taking longer than expected or outside the normal range?
Yeah. Okay, I guess the thing that you'd want to be watching out for is like symptoms of depression or some similar mood disorder. And I guess it would be normal in a situation like this for the children to be upset, to feel despondent, etc., etc. I guess the point at which you would say it's crossed from being a normal kind of reaction to something which is possibly that needs some kind of clinical attention is the idea or the construct of impairment of function. And what I mean by that is that the child is they're unable to perform functions in some important area of their life. So, for example, if they're not getting out of bed because they're just so sad, or they're not able to go to school, or they're crying a lot, so they're unable to do whatever it is they used to do.
Curricular activities.
That's right, or if they lose interest in things that they previously used to really love. So if they're really keen swimmers and suddenly they're just not interested in that anymore, etc., etc. These are kind of areas where you might say, okay, there could be some sort of impairment of function in important areas of either socialising or academic life, or even if they're working or something like that. So that's the point at which you would have to say, okay, maybe this is just more than just the normal kind of grief and feeling sad and everything. Maybe this is actually something that requires some professional input.
Yeah, and again, as you were saying before, parents shouldn't be concerned because the general practitioner that has been helping look after the kids will be that sounding board to look at if you're overreacting or no, in this one you might need to go and see.
That's right.
Have the little one might need some backup. Yeah.
That's right. Yeah. So your general practitioner is the first point of call, and if you're taking a child to a general practitioner, chances are that the GP does have a lot of experience in speaking to children, and so they would have some idea about what would be normal and what might require some extra investigation.
And Ian, when you've got your family consultant hat on, I know at the end of your reports you're forced to make recommendations to the court and probably more importantly to the parties. Of course, in the Family Law Act, there's no prescribed parenting arrangement for children. There's no default plan or plan B or something like that, or 50-50. What do you think are the best arrangements that can work for children, or what do you find is the most common living arrangements that work well for children? I know it's a hard question, but there it is.
Yeah, well, in terms of what works well, unfortunately I have to say you guys are probably better judges of that than I am, because I have an unusual situation in that I will often make the recommendations, but I actually don't tend to see what happens after that, so I don't see the follow-up very often. I just see it occasionally, not very often. But in general, what I would say, and it depends again on the developmental stage of the child, so obviously what's good for a 4 or 5 year old is different from, say, a 11 or 12 year old. But in general, I would say something that is consistent and easily understood. So for example, if it's a regular thing, like if every second weekend with one party from Friday to Sunday and one night during the off week or something like that. That's quite standard. It's reasonably easy to understand, and therefore it's easy to implement, and it also provides some level of security and consistency for the children, because when everything else is or when they've had something very unusual happen in their life with the separation of parents, it's good for them to at least feel like something is kind of
routine.
predictable and routine. That's
Yeah.
right. The good thing about that as well is that it's a relatively that the parents don't necessarily have to see each other all that often. So if you're having high conflict with the other party, then the sort of plan you probably want is one again that's easy to keep track of, easily understood, so there's not conflict around that. But also you may not necessarily have to have that much to do with the other party if you really don't want to see the other party, or if you're concerned about seeing them change over. So they're the kinds of things I think that are important in terms of predictability, routine, easily understood, so it's unlikely that conflict will be generated by that, or there'll be some ambiguity about what's, whether it's my week or your week.
Yeah, and there's crazy things you see where people have got, in week 1, 3 days, and one
That's
day,
right,
week
exactly,
2,
yeah,
6
yeah.
days. The adults can't
That's
understand
right.
it. How the hell would primary school age children
Exactly,
understand it?
And I think the parents have to really remember when discussing or negotiating or considering parenting arrangements for the children that it is about the children. It's not about them. And we see all the time, don't we, the people that come into our office, and sometimes we see it enshrined in court orders as well, parenting arrangements that are completely age inappropriate for children, and things, changeovers on Christmas Day and Father's Day and stuff like that in high conflict cases, when really it is just about the parents. Parents, kids love having 2 Christmases, or whatever, an extra birthday party or something like that. A lot of the time the focus is actually on the parents. And Ian, I know you had a specialty with teenagers, and is there something that parents can be on the lookout for, specifically in relation to teenagers and how they can help them through the separation? I know from Heather and I's point of view, that children's views, a view of a teenager is given a lot more weight, and sometimes given the only weight and the only circumstance in some matters. So what things can the parents look out for to make sure that arrangements are appropriate for teenagers, and that in consideration of the teenagers' views?
Okay. It's a difficult question for me to think of an answer off the top of my head. I mean, I guess the important thing is you have to balance a few different considerations. One is the level of attachment that they have with each parent. So, clearly, if court orders say that a teen has to spend time with a parent that they don't particularly like or feel very much attachment to, that won't work, and the teen will vote with their feet. They just won't do it. And then sometimes you may have people who return to court or try and bring the other party and try and enforce it and so forth, and really that does nothing to endear them to the teenager either. So it's important to be realistic, I guess, at the first point when you're trying to work out what sort of arrangements you're going to have is for each parent to think, well, I guess it would be foolish for a parent, I think, to try and enforce a teen spending time with them when the teen is clearly not very keen on doing it, because, as I said, they'll create a rod for their own back. Having said that, though, if we're talking about like sub-teens, I would say between about 10 and 12 or something like that, that in my experience is a more difficult area, because sometimes you may have the child, for whatever reason, may not want to spend time with the other parent, but it is actually important for them to have a relationship with the other parent, and so you would hope that in that instance that they would be encouraged by the other party to actually spend time with the other parent and say, despite the fact that you may not be feeling very well disposed towards that parent at the moment, that they are going to be your father or your mother for the rest of your life, and you will have a relationship with them, and it's actually important for you to give them a go and actually spend time with them. So I think it's important for parents to try and promote the child's relationship with the other parent.
And I think in your field we've seen some research in the last few years, for example, that was at odds with what we'd thought, which was adolescent girls need to spend a lot of time with their father. And, you know, the research that we're getting updates from all the time can often change the way we think, but we know that, that girls in high school who don't have strong attachments with their father are at very high risk of later outcomes that are not so good.
And again, I guess it comes down to that kind of idea of attachment, trying to work out just how closely do they feel to the other, to the father, for example. I mean, they're quite legitimately, there could be a lot of teenage girls that want to have very little to do with their fathers, and possibly for quite good reasons. But you know, if that's not the case, then certainly the relationship with fathers. I mean, you shouldn't basically take the approach of, oh well, it's not important for the 13-year-old girl to see her dad because it's a dad. You know, she doesn't.
She needs a mum.
Needs a mum. So and I guess that is the benefit of like family reports and so forth, where you can have someone that actually can look at the individual case and try and weigh up the different factors.
And I think the other thing that is really important is the understanding as they move through high school how important the peer group and flexibility is. And often what Ben and I see is if parents separate when their children are little, when it gets to the adolescents starting to have a say, they often think it's the other parent because they've been away in terms of that really close contact. So that need for flexibility and peer groups in adolescence, I'm imagining, is something else you need to factor in.
And that does add an extra layer of complexity to the whole situation as well, because adolescence is a time when the peer group actually becomes more important necessarily than the parents, particularly in terms of setting norms or standards or whatever that the adolescent might want to try and meet or aspire to. So, you know, you'll often find that the adolescent may not want to spend time with the other parent, you know, but it's not necessarily. I mean, that's a feature of adolescence. They don't necessarily want to spend a lot of time with their parents. It's more important to be out with their peers. So, so I guess the challenge, particularly for the parent that doesn't spend most of the time with their adolescent, is to try and still promote the relationship with the non-living. I'm trying very hard to avoid the word custody, but the parent that doesn't have full-time care. That's right. So because the adolescent, there could be just some normal resistance to doing that just because they're adolescents.
And Ian, divorce is almost always an extremely stressful time for parents. Is it okay for parents to let kids see when they're angry or upset?
I think to some extent. I mean, it depends. Sorry, we're talking which age group as well. I think the best thing to avoid is to avoid if they're angry or upset, for the child to see you venting about the myriad shortcomings of the other party, and you know, and how they're a terrible person, etc., etc. That does no one any good.
But that the observation of children watching how their parents adjust to the trauma of that life event can be beneficial, because the kids can see, well, you can survive. Mum and dad were sad, but now they're happy.
Well, that's right. Exactly. So I guess as long as there is that balance. I think the biggest vulnerability that adolescents have is their life experience is relatively short, and they don't understand necessarily that things are crap now, but they will actually get better in the future, and that's something that I think is really, really important and needs to be reinforced with adolescents quite a lot. And I try and do that in my clinical practice, not just in family dispute cases, but when adolescents are feeling like things are pretty bad in their life, to actually give them some hope that what you're feeling now is very often normal, and normalise it, but the reality is that things will actually get better, because adolescents that don't understand that's if they develop some sort of hopelessness or real despair about the future, that's a risk factor for serious suicide, self-harm, member of other really bad outcomes.
I have one more question for you, Ian. And I'm going to ask you to put your family consultant hat back on.
Sure.
And a lot of families that go through the family law courts endure, or subject to or go through the family report process. Okay, and of course, I'm sure each family report writer is different. Heather and I, we tell people on a daily basis what's in a family report process, but of course we've never done one, and you do them all the time. So I thought the last question would be great just to ask you, in your rooms at least, how does the family report process work?
Okay, because I can only talk about my own, because I don't know about necessarily how other people do it. Except I will say that it's a fairly standard kind of format, so that the report that you produce, there's expectations about what the headings are and what's contained under each heading. So you would hope, and you guys would probably know better than me as well, you would hope that most family reports follow a similar kind of format. But I mean, first of all, the format that I follow is that I contact the parties prior to the interviews, let them know when they'll be on. The person that's filed the application for the litigation, I generally see first. I generally see the applicant first, and then I see the other party after that. It involves an interview with each applicant to get an understanding about what they see as the situation, what their proposal is, how they would like to see things, or what they think is the best outcome for the children. If the person has a new partner, then I would like to see them as well. And then also really importantly to meet with the children. So if the children are if the children are at school, I would usually interview the child as well and get a bit of a sense of how they are travelling, what they feel about things, to as much as possible get an idea of what they would like to see as an outcome. And obviously if they're teenagers and so forth, ask them sort of other questions as well, but to try and get a bit of a sense of what they would think
would work.
What kind of things I think would be important for the judge to know, because the judge will be making the decision, and the decision is a decision which is aimed to be in the best interest of the child or the children. So I guess the family report is an opportunity for the child's voice to be heard in proceedings, and so that's I guess the aim that I have. So it does involve for me it would take about a day interviewing the various parties. Each party I'd probably interview for a couple of hours, and then I'd observe them with the children as well.
And that's a play session normally.
That's right. Yeah. Although I tend to kind of leave it up to the families as well. I try and be very non-directive, and I basically sit there and see whether or not the parents like to take initiative and do some play, or if they brought something with them, or that kind of stuff. It gives me a bit of an idea about what the dynamics of the relationship are.
And when do you inspect the subpoena material? That's what I want to know. Are you the type of family consultant that gets all this information beforehand and then goes in and sees the party, or do you read very little and have an organic experience?
Look, subpoena material, it's tricky because, say, in Coffs Harbour, generally, if you want to read the subpoena material, you've either got to go to Newcastle or Lismore to view it, or you've got to be organised enough to ask for the registry to send it down to the courthouse at Coffs Harbour. So there's certain logistics involved. And so that tends to determine when I read the subpoena material. So, for example, I was looking at subpoena material this morning in the courthouse at Coffs Harbour, but that was for an interview that I did recently. So, in fact, I did the interview first and then
you read it.
Yeah, I mean, certainly you read the affidavits and the applications and notices of risk and so forth beforehand, so you have a bit of an idea of what the issues are. Yeah, and I guess if the subpoena material was handy, I'd probably like to read it beforehand, because it helps you when very often you'll get divergent accounts of the same event, and so it's good to actually have read the stuff beforehand. So if someone tells you something which you know is really not quite what the other
police
documents
report says,
and
things like the school reports give that
yeah.
objective view of how the kid's travelling.
That's right. Yeah, so it's good to know beforehand.
Well, Ian, thank you so much for helping us tackle this very big and complex issue, and thank you, Heather.